Hello, I'm Fiona Joyce. I'm a women's health physiotherapist here in Cork University Maternity Hospital, which is part of Ireland's South Women and Infants Directorate. Today I'm going to talk to you about how to look after your bladder, bowels and perineum after you've had your baby. One of the most important things for your recovery in the first 6 weeks postnatal is rest. This is often called the fourth trimester. Side lying is a nice position to rest in as it takes pressure off your perineum, which can often be swollen and sore after vaginal delivery, particularly if you have any stitches. Try to keep sitting to a minimum. If you find that you are sore sitting, it is nice to sit on some rolled up towels as shown. Having the towels taped like this helps to move the towels around with you as you go through the house. In the first few days after you deliver, you might find that you don't have the urge to empty the bladder or that you lack sensation around the bladder. This is common and it should improve within the first few days. To avoid causing any issues to the bladder, it's important that you empty the bladder every 2 to 3 hours. Even if you don't feel full, it's a good idea to go into the toilet, sit on the toilet, and you might find that you actually do have a bit to pass. If you have any stinging when you are passing urine, you could use a sports bottle filled with water and squirt that around the area. Your bowels can take a few days to go after you deliver. Getting up and moving around and building up your walking as able is good to get the bowels moving. Looking at your diet is also important and making sure that you have some fibre in your diet, such as whole grain, breads, cereals and fruit with the skin on, such as pears, raspberries, kiwis. Try to avoid any stodgy foods such as breads, cakes, muffins, croissants, as they can slow down the gut. Staying hydrated is important also. If you're bottle feeding, you're aiming for 1.5 to 2 litres of fluid a day. If you're breastfeeding, you're aiming for 2 to 2.5 litres of fluid. The bowels should go within a week of having your baby. If you find that they haven't gone, then I would go to the pharmacist and talk about getting something to soften the stools. When going to the toilet, it is important that you sit on the toilet so that your pelvic floor muscles are relaxed. Ideally, you want your knees to be higher than your hips. If your toilet at home is quite high, you may prefer to go up onto your tippy toes or use a step under your feet. Leaning forward helps to get the bladder and the bowels in a better position for emptying. When you're emptying the bowels, make sure that you aren't straining or forcing to empty. Breathing out as you push down to empty the bowels. If you have any stitches in your perineum, you may find it more comfortable to use some toilet paper, fold it up and hold it against the stitches. Or if you've had a C-section, you can hold across your section site. Take care when cleaning yourself if you have any stitches so as not to rub or irritate the stitches, so pat dry. If it's after a bowel motion, you may prefer to go into the shower, use the water to clean yourself and then pat dry. If you have any stitches in your perineum, they should dissolve themselves within 6 weeks. It is important that you avoid using any chemicals on the area as it can cause irritation. So no shampoos, shower gels, baby wipes, just warm water around the area. If you have a lot of swelling or bruising around your perineum, you may find that an ice pack can help. You can make an ice pack at home quite easily by putting some water on a pad, putting it into a Ziploc bag and popping it into the freezer for a half an hour. When it's nice and cold, you can apply it to the outside of your underwear, put another pair of underwear outside this to keep it in place, and you can move around the house. Never put the ice directly onto the skin as this can cause an ice burn, and only use the ice for 10 minutes at a time, 2 to 3 times a day. Starting your pelvic floor exercises postnatally as soon as you're comfortable is another good way to clear swelling and to help with your recovery. Please watch our video on pelvic floor muscle exercises for more information on this topic. I hope you found some of the advice in this video helpful, and remember that rest is key. Thank you for watching.